Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you so much for joining us today. Konica Minolta is helping healthcare providers imagine and develop their primary imaging strategy for the future using design thinking, aided by a visual roadmap that they can customize for their practice. And our guest in studio is here today, Mr. Guillermo Sander, Konica Minolta's senior strategic marketing manager, here today to talk with us about design thinking. How are you doing today?
Very well. Thank you very much for having me.
Thank you, Guillermo, for returning to talk with us. Design thinking. We've all heard of, thinking about thinking and being specific when we're talking about, what are we going to think about? How are we going to control what we think? Because, we are what we think. But I think we're talking about something quite different when we're talking about design thinking, or am I wrong in that assumption?
You're partially right.
Okay.
Design thinking is really an approach. It's been around for a while, but it got popular a few years ago. And the whole idea is to really understand the need before you find a solution. And it's a fairly straightforward process. There's 5 steps, which is, first of all, empathize, understand the problem, what it's being solved, really understand what the customer's feeling, and understanding their challenge. Then define clearly what the problem is. What do we want to solve before we move to ideation and brainstorming potential solutions and trying to solve that problem. Then we move to a prototype stage where we try something out. A rough draft is good enough, just to make sure that we are solving the actual problem. And then we test it. Is it solving what we tried to do? And you know what? Many times we fail and we have to go back. This is slightly different than many products and services are designed, where we kind of come up with that idea, try to basically create a solution, and then try to find a problem for it.
Oh, okay. So you already have the solution in place, and in the hopes that a problem will find your solution. What we're talking about now is totally the other way around.
Correct. So the approach we developed in conjunction with very smart people from the Xavier University Center for Innovation and other top-level consultants is to apply this idea of design thinking, which was normally done for actual products, and really apply it to our whole process to help our customers understand what they want to do with imaging in their practice before we move into what they need.
Now, as a patient, I'm familiar with technicians not wanting to give you the results of an X-ray. They leave that to the practitioner once those images are transmitted to them and you've got your appointment with them. In the new advances in imaging, how much of these advances are specifically designed to help the consumer, the patient, understand what's going on with their imaging? I mean, we all can't read X-rays, certainly not MRIs and ultrasounds. How much of this is being, client focused, so that we can understand what our imaging means and what it means to you as a healthcare provider?
And while immediacy is certainly a value for the patient, clinical confidence, we think it's more important. Okay. So a lot of what we do when we look at a practice, we look at the practice from 2 ways. How can we improve your patient outcomes? Which means we want speed of care, ruling in, ruling out a lot quicker, shorten wait times for sure. And clinical confidence is one of the top requirements by the customer. A fast result is not good if it's not a good result.
So accuracy as opposed to, speed.
Speed, exactly. So a lot of what we do is aimed at helping increase the speed without losing that accuracy.
Now, does Konica Minolta become involved with, say, a specialist in, I don't know, Wyoming and a specialist in France wanting to collaborate, should they decide that, hey, I want to talk to this guy in the States about my patient here, how much of that type of communication is taken care of by these new developments that your company is working on?
It is starting to happen a lot more. Mm-hmm. Certainly collaboration is very, very important. Telehealth has been going on for a while. A smaller practice may not have enough volume to justify a full-time radiologist on staff. Okay. So they rely on somebody else somewhere else to give them a result. Mm-hmm. And we need to provide the tools that allow this to happen efficiently, but more importantly, securely. We can't just send around an email with patient information. Okay. So we are developing a lot of tools that allow that collaboration, and not just sending the information and waiting for a response, but actual collaboration. Both people can be sharing the image and really having a meeting of the minds, especially in tough cases where a consult is advisable.
Now, we've talked about efficiency and we've talked about accuracy. What about convenience? There are patients who are homebound or in a long-term elderly care facility. Something occurs where diagnostic imaging is needed or recommended, but you don't necessarily want to have an ambulance or pick up the patient at the nursing home to take them to the facility to be imaged and then brought back. What about actually going to the patient as opposed to the patient having to come to you, because that's where this huge bulky equipment is located?
That actually, you hit the nail on the head. That is what we are thinking about in terms of the point of care. We need to get imaging as close to the patient as possible. And the days where you had to go to the hospital to get an X-ray are rapidly changing. Not only by bringing radiology or ultrasound closer into an outpatient center or an urgent care center, but now mobile radiology is more and more a reality. We're leading the charge there, where X-ray machines have become small enough that they can fit into a car, and digital radiology has become sensible enough and high quality enough to allow for these services to go to the patient's residence, get the image, and immediately send it to the cloud to be evaluated and provide results with the urgency, the right urgency. If it's a monitoring, you might have a little more time. If it's a more of an urgent situation, you might need an immediate response. So we also have to think about that prioritization. But it's certainly healthcare in the home is very rapidly becoming more of a reality, which poses new technical and philosophical challenges.
Absolutely.
But it's certainly the age of Uber healthcare is rapidly approaching.
As far as learning institutions are concerned, in schools, colleges across the country and across the world, our students are taught a certain method or a certain technology, a certain piece of equipment, and they're expecting to see this equipment when they hit the real world. They hit the real world after 7 years of med school or whatever, and it's totally changed. These new advances have taken hold. Are our students going to be lost, or how much does Konica Minolta, how much are you involved in getting these new advances into learning institutions and on the schedule for classes and learning?
We are growing in that. We're learning that we need to help institutions
syllabi,
in
I
the
guess
training
that was the
and and it's not just training. We found it's pretty up and coming healthcare professionals grew up in the digital age. Even patients today, you see the Facebook crowdsourcing of healthcare, which poses a whole new that's a whole new webcast for you.
Yeah, absolutely.
but certainly they are more open to learning, and what we found is we have done some efforts in different universities, and what we found is how quickly the technology gets embraced. But as a manufacturer and somebody interested in future development, for me the most fascinating part is how quickly they come up with new ways to use this existing technology. They see one thing and they say, well, why can't I do this other thing? And frankly, it is a great source for us because it's fueling our idea pipeline to come up with needs that were just not there before because the technology wouldn't even let you dream of it.
Now, you do have a lab, a design thinking lab in Cincinnati. Is that currently still in operation? And is that the only one that you have?
We do not have it. We sponsored an event with Xavier University Center for Innovation, where we actually tried out our design thinking for primary imaging. And they kind of helped us. They already have a practice in place. They do this all the time. They have they're one of the largest healthcare administration trainers or educators in the U.S. And they were able to leverage basically their network and their status to bring in healthcare professionals from different walks of life, educators, innovators, to help us kind of think through this design thinking approach so we could actually build our tools to help our sales team and our group of professionals bring this to the individual practitioner. Many times our healthcare providers don't have the luxury of a lot of time, so we needed to create something that is fairly quick to get to understanding the customer's needs and drivers so we can help them start a process of co-creation. And what we're trying to change the mentality in the marketplace is from, here's my products, choose what you want, to say, let me understand you, your practice, your needs, your goals, the outcomes that you're looking for, and then let's jointly find a solution that would do what you need to do as quickly as possible.
Taking out the guesswork.
Not only guesswork, but it sometimes, believe it or not, it changes. Sometimes we kind of think, I need this, without thinking what problem we're really trying to solve. So in many cases, they just say, I have a broken equipment, I need to replace it, or it's becoming end of life. And when we come in and say, well, what do you want to do with it? And we come up with a different solution from what the customer was originally thinking, because once we start teasing out, okay, you need something that will make you more productive, or will help with the diagnosis, or will just reduce the patient wait time, or all of the above, or are you just looking for enhancing your opportunities? Maybe you were looking for a solution in radiology, but what you needed was better software.
So basically, it's not just a collaboration with healthcare providers concerned with the needs of the healthcare provider, but more so concerned with the needs of the consumer and their understanding of what their issues are.
Yeah, a little bit of both.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today with Guillermo Sander, Konica Minolta's Senior Strategic Marketing Manager, talking about design thinking, the approach that the company has taken, and also talking about some of the recommendations that clinicians need to think about when they're considering diagnostic imaging in their own practices. It's been great having you here with us today.
Thank you very much.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.